Hospitals run on science and evidence-based medicine, right? Wrong. Behind those sterile walls, doctors and nurses follow bizarre superstitions and rituals that would shock you. Some are harmless quirks. Others might actually be affecting your care. Never say quiet, the most feared word in healthcare. In every emergency department worldwide, there's one word that's absolutely forbidden: quiet. The moment someone says, "It's been a quiet night," chaos erupts. Ambulances arrive simultaneously, codes are called, and the calm dissolves into controlled mayhem. Every nurse and doctor has experienced this. Say the Q word, and suddenly you're drowning in trauma cases. It's so universally believed that staff will genuinely get angry at anyone who breaks this rule. Some hospitals have banned the word entirely. Staff use euphemisms like the Q word or the word we don't say. New residents learn this unwritten rule within their first week, usually after violating it once. The superstition extends beyond just saying the word. Looking at the waiting room and commenting that it's empty. Disaster incoming. Planning to leave on time. You'll be staying late. Full moon madness. When emergency rooms brace for impact. Ask any emergency room staff about full moons, and they'll tell you those nights are absolute chaos. Psychiatric emergencies increase. Violent patients arrive. Bizarre cases that belong on medical TV shows come flooding in. The scientific evidence doesn't support this. Studies show no statistically significant increase in emergency visits during full moons. Yet healthcare workers across cultures and countries will swear it's real. Many hospitals actually increase staffing during full moons because the belief is so pervasive. Whether the moon causes the chaos or the expectation of chaos creates confirmation bias, the practical result is the same. Patients in psychiatric wards reportedly become more agitated. Labor and delivery nurses claim more women go into labor. The plural of anecdote isn't data, but try convincing someone who's worked 20 full moon shifts that it's all coincidence. Death comes in threes. The pattern. Everyone swears they see. Healthcare workers universally believe that patient deaths come in clusters of 3. One patient dies, and staff immediately brace for 2 more. The tension is palpable as everyone waits for the pattern to complete. This is textbook confirmation bias and the human brain's pattern-seeking behavior. Deaths are random, but we remember the clusters and forget the isolated incidents. Yet nurses with decades of experience will tell you they've seen it too many times to be coincidence. Some extend this superstition to bad outcomes generally, not just deaths, but codes, rapid responses, and unexpected deteriorations. Once the first emergency happens, everyone's on high alert expecting 2 more. The psychological impact is real. Staff become hypervigilant after the first death, possibly catching problems earlier with subsequent patients. Is this superstition actually improving care through heightened awareness? Nobody studied it. Lucky scrubs and ritual clothing. Surgeons are notorious for wearing the same lucky scrub cap for years. That faded, worn cap with cartoon characters or sports team logos? It's been through hundreds of successful surgeries, and they're convinced changing it will break their streak. Some surgeons have elaborate pre-surgery rituals, specific coffee from specific places, the same breakfast, parking in the same spot. Any deviation from the routine creates anxiety that could affect performance. Operating room nurses have their own clothing superstitions, specific socks for specific types of cases. A particular pair of compression stockings that was worn during a miraculous save becomes mandatory for complex surgeries. The psychology here is actually sound. Rituals reduce anxiety and increase perceived control in high-stakes situations. Whether the scrubs are actually lucky doesn't matter if the surgeon's confidence improves their performance. The curse of saying goodbye. Why some nurses won't say it. Many nurses refuse to say goodbye to patients, believing it invites death. They'll say, "See you later," or "Take care," but never goodbye. The superstition is that goodbye is too final, and saying it makes it come true. This particularly affects long-term care settings where nurses form attachments to patients over months or years. When a patient finally goes home or transfers, staff carefully avoid the G word. Some hospitals have rituals around patient deaths, turning off lights, opening windows to "let the spirit leave," or forming honor guards when transporting deceased patients. These traditions provide closure and respect, but also feed into superstitious thinking. The jinx of grand rounds and teaching cases. Present a patient during teaching rounds, and they'll immediately decompensate. Describe a stable patient to medical students, and their condition will change before you finish the sentence. This is so consistent that residents avoid presenting their good patients. The rational explanation is that sick patients are sick and can deteriorate at any time. But the timing, right during presentation, feels too consistent to be random. The turfing jinx is related. Try to transfer a patient to another service, and suddenly they'll have a complication that makes transfer impossible. Emergency medicine doctors swear that the moment they call for admission, the patient's condition either improves dramatically or tanks completely. Food offerings and appeasement rituals. Many nursing stations have candy bowls, coffee stations, or snack stashes that function as offerings to appease the chaos gods. Bring donuts for the team, and maybe the shift will be merciful. Forget to stock the snack drawer and prepare for disaster. This creates social cohesion and team building, which genuinely improves care coordination. But staff often frame it superstitiously. Feeding the team keeps bad luck away. Some hospitals have actual shrines or good luck charms at nursing stations, small statues, religious icons, or secular talismans that staff touch for luck before difficult cases. Holiday food traditions are particularly strong. Potlucks, themed snacks, and celebratory meals are believed to influence patient outcomes. A well-fed, happy staff probably does provide better care, but they'll attribute good shifts to the food offerings themselves. Why these superstitions matter. Healthcare is high stress, high-stakes work with limited control over outcomes. Superstitions provide psychological comfort and perceived control in chaotic environments. They're coping mechanisms disguised as mystical beliefs. Some superstitions might actually improve care. Hypervigilance after one bad outcome potentially catches problems earlier. Rituals that reduce anxiety improve performance. Team bonding over shared beliefs enhances communication. But superstitions can also harm. Delaying care waiting for lucky items is dangerous. The challenge is distinguishing helpful rituals from harmful irrationality. Patients should know that their healthcare team, no matter how scientifically trained, are still human. They bring cultural beliefs, personal superstitions, and psychological needs into their work. If you're fascinated by what really happens behind hospital doors, subscribe now. We're revealing the hidden culture of medicine and what it means for your care. The science behind the superstition. Researchers have studied healthcare worker superstitions and found they're universal across cultures. The specific beliefs vary, but the presence of superstition is constant. Psychological studies show that superstitious behavior increases under conditions of high stress and low control, exactly what healthcare workers experience. It's not stupidity or irrationality. It's a predictable human response to demanding work. Hospitals run on cutting-edge science, but they're staffed by humans who need rituals to manage impossible stress. These superstitions reveal the psychological reality behind the clinical facade, and understanding them helps you understand the people caring for you.